The principal-agent problem relates to the duty of care that is present in healthcare, specifically the patient-physician relationship. Physicians have an advantage by being experts in their field, and patients must trust that their physician is acting in good faith. An agency relationship is formed when a party, the principal, delegates decision-making to another party, the agent. The problem for the principal is to develop a contract or relationship to ensure that the agent is acting in the principal's best interest. In healthcare, the principal is the patient that has a lack of technical knowledge regarding their health and must place their confidence in an expert to determine the best course of action on their behalf. The agent in healthcare is the physician who has studied and trained in medicine for many years and has expert-level knowledge of how to treat patients in their respective field of practice. The imbalance of knowledge in this relationship is referred to as asymmetric information. A patient may know their own condition and options for treatment, but the physician is able to take the same information and have the knowledge of what treatment is best. In a perfect healthcare principal-agent relationship, the agent-physician would choose as the patient themselves would choose if only the patient possessed the information that the physician has. Problems arise in this relationship when an imperfect agent-physician knowingly induces their patients to consume other than the optimal amount of care. This is considered being in violation of the agency relationship. Supplier-induced demand can occur in an imperfect principal-agent relationship and involves the physician-agent knowingly and unnecessarily increasing the demand for care by acting in their own self-interests. The self-interests can stem from income pressure on their practices to increase their own personal income. Research has shown that OB/GYN physicians will recommend more C-sections, a more lucrative treatment, than when their practice incomes are threatened by competition. Reimbursement methods also have an effect on this relationship. For example, in a fee-for-service method, physicians are paid per service provided, thus potentially leading them to provide more services even though they may not be needed. The ordering of unnecessary medical tests is considered a violation of this relationship, as physicians will be provided some reimbursement, but costs not covered by insurance will be the responsibility of the patient that may not be able to afford it. There is evidence that physicians have personal goals for income and adjust their practice prices and qualities when those goals exceed their current income. Again, working to their own benefit and not in the best interest of their patients. In this type of agency relationship, it is inherently possible for patient preferences to be lost in communication, so it's important that the principal patient be clear in their health goals and intentions to their physicians. It is also important for principal patients to do their homework and be as well informed as they can about their health conditions. The existence of informed buyers help exert discipline over the market and helps keep agent physicians accountable. Another way to ensure the physician-patient relationship is fairly maintained is to implement a continuous relationship that provides the patient with increasing information with which to monitor the physician. This information provided over time places constraints on the extent to which the provider is able to deviate from an agency responsibility, and does give a bit more power back to the patient. Additionally, a physician's Hippocratic oath to do no harm, licensure and accreditation, and the threat of litigation all limit the ability of providers to deviate from their agency responsibilities. It is also the responsibility of the healthcare organization to make sure providers are acting in accordance to the mission and values set forth. Examples should be set by leadership and distributed down the chain of command. There is a level of trust in the relationship between patient and physician that is unlike any other. There are patients with different levels of knowledge, and it is up to the physician agent to act in good faith and provide the most optimal quantity and quality of care. The agency relationship in healthcare is a fine set of checks and balances that must be maintained by the physician, patient, and healthcare organization as to not cause major disruption in the market and induce any type of market failure.